Hey, this is Critical Care Coach Ashanti coming straight from inside the Trauma Center. I want to come to you and bring you a 4-week series, and this is going to be an introduction video to talk to you about mechanical ventilation in the ICU patient. Disclaimer, this is for educational purposes only. You are to get your formal instruction and training from your institutions and your organizations for which you work for. This is to augment that education and training. So, my name again is Critical Care Coach Ashanti, and this is an introductory video talking to you about a 4-week series going to go over mechanical ventilation and the ICU patient. Let's begin. Now, one of the things I need you guys to be very, very clear about before we start. Nursing 101 is your foundation and your assessment that goes along with that. Nothing is ever going to change. Coming to ICU, you're going to level up all of your skill set. And so mechanical ventilation is one of those skill sets that you must get a handle on in order to care for your patient inside of ICU. Okay? So mechanical ventilation is a machine that will help my patient breathe when they can no longer breathe on their own, right? So what does mechanical ventilation literally do? It supports pulmonary gas exchange, right? And where does it support that gas exchange at? It supports it in the alveoli. Yes? What is it going to do for my patient at the bedside that you need to see? Is going to reduce the work of breathing. So most of the time when a patient is coming to you, and I'm going to give you 3 things that they may come to you with needing a mechanical ventilator. Cardiac arrest, a heart attack, a myocardial infarction, or a trauma like a motor vehicle accident of some sort, right? So with that being said, the objectives to mechanical ventilation, they're going to reduce some things for you. They're going to reduce hypoxemia. They're going to reduce acute respiratory distress. They're going to reduce respiratory acidosis, and then respiratory distress, not in necessarily that order, atelectasis, and it also is going to reverse the permission of sedation and neuromuscular blockades. I cannot stress enough, we're going to go over these in detail in lesson 1. This is just an introductory to let you know that the ICU patient sometimes is going to need a machine to help them breathe, and this is the majority of your patients inside of ICU. So as being a new nurse, as a new grad, or a new nurse transitioning into a new career, a new discipline, which is critical care, coming from med-surg, ER, cath lab, OR, rehab, SNF, home health, does not matter. We will train you if you get inside of our organizations and want to transition into critical care, okay? So to recap, mechanical ventilation is a machine that's going to help my patient breathe. What is that breathing going to help my patient do? Support pulmonary gas exchange, and where that gas exchange is going to occur, it is going to occur in the alveoli, right? And what is it going to do mainly? It is supporting reducing the work of breathing. Why I want to reduce the work of breathing? So my patient can heal with the treatment plan that we're going to work together with, and to get them off the ventilator, get them off the machine, okay? Some of the things that we want to reverse with mechanical ventilation is hypoxemia, respiratory acidosis, respiratory distress, atelectasis, and permit of sedation or neuromuscular blockades. Again, this is Ashanti White coming to you from inside the Trauma Center. Have a great, great afternoon.